Hello, my name is Mary Beth Landis and I work as a registered dietitian in the Center for Cancer and Blood Disorders at Augusta Health. If you're watching this educational video, you've likely been prescribed a treatment plan that includes the use of androgen deprivation therapy, such as Lupron or Casodex, used in the treatment of prostate cancer, or aromatase inhibitors, such as Arimidex, anastrozole, or exemestane, used in the treatment of breast cancer. Both of these treatments have one of the risk factors of increased risk of osteoporosis. And so it's important that you consume adequate amounts of calcium, vitamin D, and also participate in regular weight-bearing exercise and resistance training in order to keep your bones as strong and as healthy as possible for years to come. So starting with calcium, calcium is the most abundant mineral in your body, 99% of it occurring in your bones and in your teeth. It has several functions, primarily including your structural integrity, meaning the health of your bones, but it's also important in maintaining regular nerve function as well as the function of your heart and normal blood clotting. The goals for calcium are 1,000 to 1,200 milligrams of calcium per day, and it can be found in a variety of foods and beverages. If you don't consume adequate calcium from foods and beverages, then it's important to meet your needs by taking a supplement. Now remember, more is not better. So you want to avoid taking more than 1,500 milligrams of calcium per day because it can actually have negative health effects, which we want you to avoid. So looking at how much calcium certain foods and beverages have is our first step. You can see by the chart that 1 cup of soy milk contains up to 350 milligrams of calcium. Now this varies by the brands that you choose, so it's important to look at the nutrition label for the actual amount. 1 cup of cow's milk contains 300 milligrams, while 1 stick of string cheese contains 300 milligrams as well. Yogurts vary. Plain yogurt contains approximately 260 milligrams in 3/4 of a cup, while Greek yogurt contains 180 milligrams in 3/4 of a cup. Looking at some of the plant-based calcium options, these would include beans, legumes, broccoli, nuts, and dark green leafy vegetables. Some examples include kidney beans that can provide 180 milligrams of calcium in half of a cup, collard greens that provide 175 milligrams of calcium in half of a cup, or spinach, which provide 120 milligrams of calcium in half of a cup. Almonds are a nut that provide 95 milligrams of calcium in 1/4 of a cup, or broccoli also contains 70 milligrams of calcium in half of a cup. Now to look at how this would play out in terms of your meals and snacks for the day, if you consume animal products, you can meet your needs by consuming 1 cup of yogurt with breakfast, 1/4 cup of almonds as a morning snack, 1 cup of milk with lunch, and an additional cup of milk and a cup of broccoli with dinner, which would provide 1,095 milligrams of calcium for that meal. If you prefer to follow a plant-based diet, then consuming 1 cup of calcium fortified orange juice with breakfast, half of a cup of kidney beans with lunch, and 1 cup of cooked collard greens along with 1 cup of soy milk for dinner would provide you with 1,240 milligrams of calcium for the day, again meeting your calcium needs. If you're not able to consume adequate amounts of calcium from your intake of foods and beverages, then it's important to take a supplement. There's some important things to know when choosing your supplement. First, calcium is best absorbed in smaller dosages. So look for a calcium supplement that doesn't contain any more than 500 milligrams of calcium per tablet. If you consume approximately 600 to 700 milligrams of calcium from foods and beverages, then you would only need to take 1 500 milligram tablet of calcium to meet the rest of your needs. However, if your consumption of calcium from foods and beverages is minimal, then it's important to take 2 500 milligrams tablets of calcium per day, but separate them out by 4 to 6 hours for maximal absorption. There are different forms of calcium supplements available as well. calcium carbonate is the most widely used and the least expensive. It does require stomach acid to be absorbed and is best absorbed when taken with food. If you take a proton pump inhibitor, which decreases your stomach acid, then it's important to use another form called calcium citrate that doesn't require your stomach acid for maximum absorption and also can be taken with or without food. Moving on to vitamin D. Vitamin D is extremely important for the optimal absorption of your calcium. If your body is deficient in vitamin D, you only absorb approximately 10 to 20% of the calcium that you consume. However, if you have adequate amounts of vitamin D, then your body can absorb 30 to 40% of the calcium that you consume, leading to your bones being much stronger and you leading a healthier, active lifestyle. Now, vitamin D is best absorbed from sunlight through a chemical interaction that occurs in your skin. However, vitamin D deficiencies are more and more common because of colder weather, as well as wearing sun protective clothing and sunscreen due to the risk of sun exposure. And so it's important to consume foods high in vitamin D, but also because this tends to be inadequate, it's also recommended to take a supplement that contains 600 international units, which is the recommended dietary allowance for vitamin D for the day. To give you an example of foods that you can consume, so looking at foods that either contain or are fortified with vitamin D, 3 ounces of sockeye salmon contains approximately 570 international units of vitamin D, which in about a 3-ounce portion, which is approximately the size of a deck of playing cards or an old cassette tape. Cow's milk as well as soy milk is also fortified with vitamin D and provides approximately 100 to 150 international units of vitamin D per cup based on the brand. Cheerios are also fortified with vitamin D, providing 80 international units in 1.5 cups. And eggs and canned tuna also have naturally occurring vitamin D, 44 international units in 1 large egg and 40 international units in 3 ounces of canned tuna. So while it's important for everyone to take a supplement also containing 600 international units of vitamin D, your provider may also check the vitamin D levels in your blood. And if those are found to be deficient, they may recommend or prescribe a dosage that's higher than the 600 international units. It's important to take whatever dosage your provider prescribes to you in order to get your vitamin D levels back up to a normal range. And lastly, it's also important to participate in weight-bearing physical activity on a consistent, regular basis, as well as resistance training 2 to 3 times per week to keep your bones as strong as possible. If you're already doing this, then congratulations and keep up the good work. If you're not and you would like help getting started, the Augusta Health Fitness Center has a prescription exercise program that can start with you wherever you are now and safely increase your level of physical activity in a way that works well for you and will also help to keep your bones strong. If you would like more information about that program or would like to sign up, please call 540-332-5527. In conclusion, ensure that you're meeting your calcium needs with 1,000 to 1,200 milligrams of calcium per day, meeting your vitamin D needs with 600 international units per day, and participating in regular, consistent, weight-bearing physical activity, as well as resistance training 2 to 3 times per week. Thank you for listening to this educational video, and I wish you good health and strong bones in the years ahead.